At 5, okay? Everybody ready?
We're set.
5, 4, 3, 2.
Good morning, Warren County residents. These are certainly extraordinary times that require a change in our lifestyles for an undetermined number of weeks. Both the President and our Governor have taken steps to contain and mitigate the spread of the COVID-19 virus. I've issued a state of emergency with recommended guidelines and precautions for all residents to use. We have plans in place to act quickly and effectively with changing conditions. A hotline number will be available to direct residents to appropriate agencies for assistance or those that might be in need. Local businesses are accommodating customers with alternate operations and schedules. Programs are being implemented to assist in food distribution programs and to assist in people's medical needs. Schools are adapting new teaching models with the use of technology. I'm in constant communication with my Warren County preparedness team, who are our front line of defense during this crisis. Washington and national officials keep us updated as situations arise. In the meantime, I urge each and every one of you to act with certainty and take all measures to protect the safety and security of your family, your co-workers, and your friends. Remain calm and do not panic. Share with others as much as possible. Despite the challenges and the shutdowns, all essential services will continue on all levels of government. Most county offices are closed to the public or with appointment only. Please call those offices for information about making appointments or making payments. We will accommodate as necessary. The admin building and the courthouse will remain open on a limited basis, Tuesdays and Thursdays, 8 a.m. and 12 to 12 noon by appointment. All this information will be updated on the county's website and shared with the media for your convenience. We are all in this together. United we stand on a national, state, and especially a local level. With cooperation and caution, Warren County will weather this storm. We need to assist each other, make some changes in our lifestyles, and support our local businesses as much as possible, and make accommodations for all of our employees. I'm here to assist in any way possible. And as my grandmother used to say, level heads will prevail. God bless America, the state of Tennessee, and all of Warren County. Now I'd like to read my state of emergency order. Due to the COVID-19 crisis facing our local community, in accordance with Tennessee Code Annotated 58-8-104, I'm continuing the county-wide state of emergency order to protect the safety and security of all of our residents. Over the last few weeks, my emergency preparedness team has put plans in place that will be modified as conditions change. All orders coming from federal and state levels will be honored and adapted as needed to conduct county operations. I'm limiting public access to all county facilities and ask for policies and protocol to be implemented by all offices to accommodate the challenges ahead while still providing all essential government services. We will continue to communicate with FEMA, Homeland Security, and all health agencies and respond as necessary to assist and administer programs that are made available daily. Our local teams will mobilize resources and utilize any emergency funds as needed to contain, mitigate, and treat this outbreak. We will continue to monitor all events and adapt our plans accordingly. With assistance from our law enforcement officers, I will act under emergency authority granted by the state of Tennessee to maintain all law and order across Warren County. I'm recommending that everyone follow standard health guidelines issued by the CDC and limit social contact with those individuals who are at risk for this disease. Vulnerable populations should stay at home and avoid social gatherings where exposure to the virus is likely. We all understand that these are extraordinary times where quick action is necessary to protect the lives of all residents of this nation, of this state, and of this county. This order shall remain in effect until May 11, 2020, in alignment with Governor's State of Emergency Proclamation and renewed weekly. I urge all residents to follow Governor Lee's Executive Order 17 in effect until April 6, 2020, which outlines guidelines, recommendations, and others for alternate business operations, limiting social gatherings to 10 or more, and banning in-house dining in restaurants. I now want to turn the podium over to Mayor Ben Newman from the City of McMinnville and then to Dale Humphrey from St. Thomas Ascension, and for Andrea Fox from the Public Health Department. Thank you.
Thank you, Executive Haley. I'm Ben Newman, Mayor of McMinnville, Tennessee. Welcome, McMinnville and Warren County and anyone else who's watching. I'd like to say that I believe that our community has come together to really help stave off this pandemic as it's making its way here. We have no confirmed cases here in McMinnville or Warren County. We've had people tested, and all of those tests, to our knowledge, have come back negative, and that's good news. However, that doesn't mean that we shouldn't do anything. The governor of the state of Tennessee, Governor Lee, as Mr. Haley stated, has closed restaurants except for takeout and carryout. He's closed gyms, and he's not allowing more than 10 people to congregate socially. This morning, the U.S. Surgeon General was interviewed on television and stated that all people should stay home unless necessary. I've seen change in our businesses' behaviors recently that goes along with the social distancing that people have imposed upon themselves. A lot of businesses, some of our major factories, are shutting down for 2 weeks, and a lot of businesses have self-imposed shutdowns through April 6th. Because a lot of our businesses, our large businesses, and some of our smaller businesses are doing this, I would urge you to follow suit and do the same thing if you can. The mayor of Nashville has ordered that all non-essential businesses shut down. There are a lot of businesses that are considered essential. I'm not going to go through that list. I think the mayor's website in Nashville, Tennessee has a list of those. And I'm not ordering any of those things. However, I do urge you to follow suit. I think it's something that we should all do. Social distancing is extremely helpful, and staying at home if necessary, or unless you have to get out, is necessary. Grocery shopping, going out to eat, are still things that we all have to do. We all have to get out to exercise. I encourage you to stay home unless necessary. If you have needs to go out, go grocery shopping, but do it safely. If you have a gym that you can no longer go to, try to get outside and exercise, or use online exercise programs if offered. Try not to visit the elderly at all costs, or are vulnerable or at-risk people. Check on them through electronic means. Call them, FaceTime them, or use any other thing, social media, that you can. Right now, there are many people who may not be able to afford to eat. A lot of our children are out of school. There are systems in place, as Mayor Haley stated. We have the Senior Citizen Center that has free meals for the elderly. Our school system is stepping up to provide meals for students. Many of our churches are providing much-needed assistance to people that need it. Our whole community is stepping up to help in this fight. There's also a Facebook group called Connecting Warren County Amid COVID-19. I encourage you to get onto that and look and see what our businesses are doing to help. There's a lot of information on there about who is open and when, phone numbers to use, and how to contact these businesses to get takeout. I'd like to thank our nurses, doctors, pharmacists, everybody who's kind of on the front line in other areas, and then in our areas as well. Our city offices are currently closed to the public, as for our water department and city hall. People can still obtain permits at Public Works. Otherwise, if you need to pay water bills, I implore you to go online, call, or you can make an appointment by phone if you need to change water services or get new water service. Right now, we are no longer cutting off people until further notice, so there will be no water cutoffs for non-payment. Thank you for your attention in this, and remember that we all need to take this as seriously as we can. You'll hear from some of our health experts in our community, and please heed what they have to say as well. Thank you.
Good morning, Warren County. The Warren County Health Department is working in partnership with the State Department of Health and the CDC regarding this rapidly evolving situation. Currently, as has been stated, we have 0 cases in Warren County. As of yesterday at 2 p.m., Tennessee had 505 confirmed cases. The recent increase in numbers is expected and will continue to increase as we do more testing. We can do our part to flatten the curve by practicing good hygiene, following social distancing, and staying home when you are sick. If you feel that you need to be tested, it is very important to first call your primary care provider, and assessment will be conducted over the phone. We will do those assessments via phone, and if it is determined that you need to be tested, you will go to your local health department or your local provider, whichever one that you may have. Please practice good hygiene on a daily basis by washing your hands with soap and water. If you do not have soap and water available to you, you can use alcohol-based hand sanitizer. Cover coughs and sneezes with your arm or tissue. Clean and disinfect highly touched surfaces regularly. Practice social distancing. Stay home when you're sick. Stay home if you don't need to be out. And stay away from people who are sick. Since this is a new virus, the public health response and guidance will constantly evolve during this situation. Many of you wonder where you can get answers. You can call your local health provider. You can call the Warren County Health Department for those people in Warren County. We are available Monday through Friday, 8 a.m. until 4:30 p.m. That number is 931-473-8468. You can also call the Upper Cumberland Regional Health Office hotline. It is for all of our 14 counties in this region. That number is 931-646-7586. It is also available from 8 a.m. until 4:30 p.m. The state hotline number is also available from 10 a.m. until 10 p.m. at 833-556-2476 or 877-857-2945. Additional resources, if you have more questions, you can go to tn.gov website or the CDC website. Again, follow public health guidance, social distancing, stay home if you are sick, and practice good hand hygiene. Thank you.
Good morning, fellow citizens. I'm Dale Humphrey, the CEO of St. Thomas River Park Hospital. I appreciate the mayor's comments earlier. Your healthcare workers are stepping up to extraordinary measures during extraordinary times, and we appreciate the many kind comments that we've received from those of you in the community. Currently, the hospital is very busy. We are not at full capacity by any means. We do have adequate personal protective equipment, and we are grateful for that, and we're receiving new equipment this week. We're also reaching out to other resources to make sure that throughout our St. Thomas Health system that we have adequate supplies to take care of what may or may not happen. I would like to reiterate that the hospital has changed a lot of our procedures, and many of you that have visited us have seen this week. We are currently screening anyone that comes into the building, including myself, for temperature, cough, shortness of breath, to determine whether or not they will continue into the building. Our biggest risk and danger is to our healthcare workers potentially becoming infected. And while we make appropriate measures and follow all the guidelines, we have seen other hospitals' capacity to take care of their communities seriously injured when members of the healthcare staff become exposed and are sequestered at home. One reason that we ask you not to come to the hospital as a visitor, currently we have a zero visitation policy with a few minor exceptions. This is to protect the visitor as well as the healthcare workers. We ask that if you're bringing someone to the emergency department, unless they're a minor, we will ask the person that brought them to wait in their vehicle, where we will communicate with them via telephone and give them updates so that you're not in an area of high exposure potential and that we can keep your loved ones safe while we take care of them. We also have stopped elective surgical procedures, so unless someone has a necessary needed surgery or harm could come to them by not performing that procedure, we have ceased to do those and will continue to monitor those on a daily basis to make sure that we are taking great care of our community. Again, I would like to reiterate, the best thing we can do is not believe some of the things you see on Facebook, but from the sources that are out there and the resources through the CDC, the Tennessee Department of Health, and other local government officials. We want to be timely and accurate with that information. We are blessed that not only in Warren County do we have no confirmed cases yet, but neither does Grundy, Van Buren, White, Cannon, and DeKalb counties. I feel like this will change. We are prepared for that change, and we will take great care of those people that we're honored to serve. However, you can help by distancing yourself, as has been mentioned. If you feel like you have COVID-19, you potentially may not even receive a test until adequate testing supplies are available throughout our community. Physicians' offices currently have the test available. The hospital does have the test available, but you will have to meet a strict criteria in order to receive that test. Most of you, if you get COVID-19, will not suffer serious effects from getting it. And the best course of action is for you to stay at home, limit any exposure to anyone else, and just ride the course of the disease. When you come to the hospital, we do not have a magic pill or a vaccine at this point in time to treat it, and so most of you are better off just staying at home, even if you have concerns about being infected with COVID-19, and you will actually endure that. And I'm sure several of us in our community potentially have had it, gone through it, didn't even know we had it, and we're thankful for that. This virus affects both the upper and lower respiratory systems sort of at the same time, and that's why it's been a unique challenge for healthcare professionals and researchers to figure out exactly how to address it. Again, thank you for your time and efforts. Thank you for the many kind comments we are hearing about our healthcare professionals. I assure you they will have much asked of them in the coming weeks. Unless you need us, please stay at home, enjoy your family and friends and loved ones, keep social distancing, and let's keep our community safe. Thank you.
County Executive Jimmy Haley again. Just want to reiterate a few things that have been said today and to basically convince our public that we do have a preparedness team in place that is ready to act if cases do arise across Warren County. As been stated before, there are no cases. And so there's a lot of rumors out there that says otherwise, but depend upon the professionals and the elected officials for the information that is correct. We don't need to panic, folks, and make people take drastic measures when there's none to be taken at this point. This is still serious, and as a community, we will work together. My whole preparedness team will, in order to make this as easy and comfortable and as normal as we possibly can as a community. I want to thank Ben Lohman for allowing us to do this today, and all the media who has kept everyone abreast of the changing conditions. We don't know if there's going to be a shutdown. We don't know if there's going to be home sheltering, but make preparations for that already and put those things in place. Be a little bit more proactive rather than reactive, and you will weather this storm a lot easier than doing panic purchasing at the end of an announcement. The governor has laid clear many of his orders of his executive position to protect each and every citizen. Once again, the social gatherings, the eating establishments, not having in-house dining, doing everything to support local businesses and keep the food chain operating. For gyms and exercise facilities to close, but to do digital programming or Facebook Live recreation activities. Limit all the visitations to those who might be ill. Limit anything to nursing homes or retirement communities or short-term assisted living centers or long-term assisted living centers. Health providers know what's best, and they may have already taken action in those facilities to close it to the public. Businesses, of course, have been encouraged by Governor Lee to adopt alternate business schedules and enact policies in place to protect employees, but also to try to keep their doors open as much as possible, because we still have needs for food and medicine and other required services. If possible, we ask employers to promote work from home and have remote employees on laptops or doing whatever is possible from home. Avoid the unnecessary social gatherings. Avoid any kind of discretionary trips and travel. limit your contact with at-risk populations. Once again, reiterating good personal hygiene and sanitary measures taken by everyone. And the promise that from the governor and from the president and from local officials, we will do our best to provide all essential government services across this community. There's not a sheltering program in place, but please, once again, take heed. One of those may be coming. I will have a hotline in my office, 474-3781, that will be available soon. Until then, you can call my office at 473-2505 if you need directions on where to receive services or who has feeding programs, or you have some need that one of our community agencies can provide for you. Our health providers at the hospital and our health department are doing an exceptional job. Our EMS and first responders and healthcare providers out there have stepped up and are meeting the needs of this community. And so by all working together, I think we will weather this storm. I'm in constant contact with Washington and in Nashville with elected officials, and so they channel the information to me. I get it out as soon as possible. We can weather these storms, but conditions do change daily. Use precautions, adapt a lifestyle that reduces exposure. It does not put you and others at risk. Act with certainty and use discretion at all time, at home, in the grocery stores, and at work. The governor asks, all of our elected officials ask, that you cooperate with these measures and play it safe. Thank you.